Well, it's emergency broadcast time. I saw an article last night in the news that energy drinks were causing leukemia. Well, that got my attention because I drink a lot of titch. I drink a titch amount of energy drinks, so I had to go looking that one up. Good morning, by the way. It's Dr. Toker, your friendly neighborhood colorectal surgeon, and once again on the deep dive, so you do not have to go do that. The news report was that taurine, that's commonly placed in energy drinks, is associated with leukemia and a worsening of leukemia. No, what else isn't causing cancer in this world, right? So I went on to the National Library of Medicine website, one of my favorite go-to places for the real information. Surely enough, 5 days ago, in the Journal of Nature, which is a big deal scientific journal, by the way, so take this seriously, they studied things that cause the acceleration of leukemia, and in this particular paper, they were talking about taurine. Taurine is a natural amino acid. Your body makes it. It's not essential. It's a pretty cool molecule. It's an antioxidant. It helps neurologic health. It helps cardiovascular health. It will bring electrolytes to your muscles. And so you can see why they would put it in an energy drink, right? Kind of a neat add-on bonus is that taurine, gotta cool off my coffee. Taurine can counteract some of the jittery effects of caffeine. So when you mix taurine and caffeine together, I mean, you can get quite a little emotional and physiologic boost from that without the jitters and the high blood pressure and that sort of thing, which is, of course, why they do it. That way, 18-year-old boys playing video games can drink 18 of these drinks per night. This is a concern because that is the age group that's at risk for leukemia. So what did they find? When you have a patient with leukemia, in the presence of taurine, it can transform that leukemia into a very aggressive version. In other words, the disease progresses very rapidly. Now, we used to think taurine was only made in the liver and a couple of other organs, and this paper elucidates a de novo source of taurine from the bone marrow, which they didn't realize the bone marrow could make taurine. And then they posit the question, in this population of patients that can now consume taurine at very high doses very easily, they could have an accelerated leukemia as a result. So what do we do with this information? First of all, leukemia is kind of prevalent in younger people. So young people should not be drinking energy drinks anyway, to be honest with you. An undiagnosed leukemia can ramp up extraordinarily rapidly in the presence of these drinks. Now, not to make everyone paranoid, but I think if you're someone who has leukemia, has a history of leukemia, is at risk for leukemia, has taken a drug, chemotherapy, or radiation that might put them at risk for leukemia, these people should avoid taurine supplements at all costs. The rest of us should probably pay attention. If you're starting to have super weird symptoms and you've been drinking a lot of carbonated, or not even carbonated, just a lot of energy drinks with taurine in them, maybe time to stop that, and then maybe time to see a doctor, and in the meantime, you can do what I do, switch to coffee.